one of the concepts that we hear a lot about lately is clonal tiding, the idea of continuous therapy, and what does that do to that treatment-free interval. This is an area of interest for you, Paula. Can you explain a little bit about clonal tiding and then how that leads into what we do from a treatment perspective?
Yeah, you're actually right, because we get the question from colleagues, the question actually from patients too, because they are more intrigued by the concept of knowing that there are multiple clones. So we're learning that probably the reason why myeloma is called multiple myeloma, because there are different group of cells, different clones that coexist actually at the same time since the time of diagnosis. And what is unique about what we know about this is the fact that this clone actually persists over time. Sometimes they can come back, and they can actually be the same. And this is what clonal tiding exactly means. But these have several clinical implications. First of all, this is the reason why we all like to combine therapy, different agent with different mechanism of action since the beginning, since the diagnosis. It's implication because at the time of the maintenance, when we think even the disease is under control, we still like to keep patient under a maintenance therapy with the idea of controlling clone. They may not detectable, but they're still there. And the idea of having, of knowing that sometimes the same clone can come back later on, give us the advantage of reusing the same drug that, for example, worked before one more time at a later point.
So Daryl, given our Canadian landscape and the difficulty we have with reusing drugs, based on what Paula just said, how do you think we as clinicians can use clonal tiding and treat patients effectively?
I think one of the things that Paula just mentioned was continuous therapy. And I think our trend has been to move toward that over time. So fewer breaks to allow the clones to change. And also there is some opportunity for reuse. So most provinces have the opportunity to reuse bortezomib, for example. And we may be getting some opportunity to reuse pomalidomide as well.
Okay.